Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM, and today I have my special guest, Dr. Manjula Raguttu, and we are going to be talking about three important topics. The first topic is going to be on sudden death among Indian population. Dr. Manju, welcome to Triple N Media. We're delighted to have you, and you're going to be questioning me since I'm a cardiologist. Go ahead.
Thank you so
Tell me
much,
a little bit
Dr.
about
Nikam.
yourself.
So I'm a family physician and also a functional physician. So my specialty would be trying to identify the root cause and then trying to work through that to prevent problems and health disorders. So now we see that there's a lot of sudden cardiac death in younger Indians. And being a cardiologist, I would like you to give us some of your thoughts. What is sudden cardiac death? And what is a heart attack? And what can cause the arrhythmias? And let's try to enlighten some of our staff or the people who are listeners about heart disease in Indians, particularly the South Asian Indians, which we see a lot more higher risk who are in the US.
Absolutely. I've been a cardiologist for more than 40 years, and it's not surprising if I tell you that Indians have the highest risk of heart disease among any other ethnic groups in the world. The incidence of heart disease among Indians is like 9.6 for 100,000 population, compared to the Americans, who we think eat all kinds of different kinds of foods. Their incidence is 2.4 per 100,000. You ask about what is cardiac arrest and what is sudden death and all this. Let's define some of these terms. Sudden death is loss of life within an hour of onset of symptoms. Sudden death can be from a heart attack, which can be from a irregular heart rhythm or a massive damage to the heart muscle. Or sudden death can also happen in patients who have a massive stroke or big blood clots known as pulmonary embolus. So sudden death can be from drowning and all these other causes, but we're going to be focusing upon what is sudden death in relationship to the cardiovascular disease, which I told you is the highest among the Indian population. Why is the cardiac disease highest among the Indian population, we may ask. Indians have a much higher predilection for heart disease for several reasons. Number one is our diet, which is very rich in carbohydrates, which leads to high blood sugar, vascular problems, hypertension, obesity, and all of these risk factors plus family history, all of these factors add together to create an environment where Indians have the highest incidence of heart disease. Indian population also has very low levels of HDL, or the good cholesterol, which is supposed to be protective against heart disease. So putting all these risk factors together, if we had family history of diabetes and smoking, all of this is a perfect recipe for a very early onset of heart disease, cardiovascular problems, heart attacks, heart failures, and sudden death. So let us talk about how do we identify a population such as Indians, and when do we start screening for people?
Screening, yes.
First of all, if you have a family history of diabetes, or if you have diabetes, you should be screened for heart disease at the time when you're diagnosed to have diabetes, because diabetes is supposed to be equivalent to someone already having a heart attack. If there's no strong family history of diabetes, if there's a strong family history of heart disease, then you must be screened at the age of, I would say, 30 years or 35 years. And I tell you what things we need to do. And it's very unlikely that most of us don't have a family history of heart disease. Somebody in the family on either side has a history of heart disease, hypertension, or cardiovascular problems. So I would say for the Indian population, the best time to screen would be ages 35 to 40. What kind of screenings do you need? First of all, the history is the most important thing. If you are having chest pain, heaviness, tightness, shortness of breath, fatigue, weakness, or any other symptoms, you need to be completely evaluated for cardiovascular risk factor. And that would include a thorough examination, an electrocardiogram, and if you hear a heart murmur or any other extra sounds, then you need to get an echocardiogram, And if there's history of any kind of discomfort in the upper abdomen or in the chest, a nuclear stress test would be the ideal thing to do to identify early detection of a coronary artery disease. And I think detection and prevention is probably the best cure when it comes to preventing sudden cardiovascular deaths. So once we do these preliminary studies, we will know how to manage these patients. There is the American College of Cardiology website and also the American Heart Association website, the links which I'm going to put here. And there you can actually go and put your age, your blood pressure, your cholesterol level, your sugar level, and smoking history, obesity, and actually know what your risk of having cardiovascular events in the next 10 years. So this is called the cardiovascular risk events. So with this basic knowledge, I think this should give you an alert at this year, because we see a lot of young population, who need to be screened, who are not getting screened properly, because as I said, heart disease is the #1 killer in the world, and it is more so among the Indian population.
Sure. Nice. Okay, can you talk about the Indian diet versus the Mediterranean diet? Is there any difference in the
I think
heart
there's no
disease?
comparison between Indian diet and the Mediterranean diet. Mediterranean diet is very, very high in vegetables, green and colorful vegetables. They eat very small amount of carbohydrates. They eat lean meat, and most of these people are lean, and they have a very low risk of heart disease. There's a direct correlation between the blood cholesterol level and heart disease risk and mortality or heart attack related to cardiovascular problems. So as far as Indian diet, I think what we can do is, the simplest thing we can do is we need to cut our carbohydrates by at least 50%. That's what I did. And I lost almost 20 pounds. I was like 186 pounds. Now I'm down to like 166, 167. I think we eat more than what we should, and everything that we don't eat, like this one nurse who said, 1 second on your lips, the rest of the life on your hips. And it's not only on your hips, it's going to go into your arteries and cause all these cardiovascular problems. The first thing I would say is cut your carbohydrates, get a good medical checkup, follow up, and keep your weight under ideal scale. For your height, what is the maximum weight you can be, and try to keep your weight below that, because weight directly relates to other cardiovascular problems like sugar, high blood pressure, and kidney problems and all these things.
Okay, can you also comment on the calcium score test? Because nowadays over here do a calcium score. Would that reflect what is in the
calcium score basically says is calcium on your coronary arteries. How do we get calcium on the coronary arteries? Whenever there's an inflammation going on in the small arteries that supply the heart muscle, and there is healing process also going on. And during the healing process, there is deposition of calcium. So calcium is an indirect evidence of that there is some kind of inflammation going on in the coronary arteries, which may eventually lead to significant blockage. If it is totally blocked, that results in a heart attack. So the amount of calcium present in the coronary arteries is a reflection of how much inflammation is going on in the heart. It is so much so the American College of Cardiology and the American Heart Association has added that as an additional simple test that we can do, besides the ones which I already mentioned, EKG, echocardiogram, nuclear stress test. We can do even a calcium score in the initial screening of patients, especially the Indian population. And the calcium score is something you can get for $100 with a CAT scan. There's no injection involved. It's a very simple test. And every Indian should get a calcium score done at the age of 40 years, at least to know if there's evidence of inflammation going on. And that will help us to get early treatment of lowering cholesterol. Anytime somebody has a significant amount of calcium on the coronary arteries, whether they have symptoms or not, are recommended to be on like 40 to 80 milligrams of statins, which is supposed to be an anti-inflammatory agent to reduce the inflammation in the coronary arteries. That's a very good question.
Okay. And the second thing is, can you comment on sleep disorders that affect the heart, and also on stress management, which I think
Yeah.
it affects more Indians
I
than
think
not.
like here is a list of the. I'll post this also risk factors that is listed on the American Heart Association website, and they say lack of sleep is also a factor that leads to. When there's lack of sleep, you have to understand there's something that's causing lack of sleep. Worries. Worries results in release of hormones,
Right.
especially adrenaline and all this, which increases the heart workload and also leads to elevated levels of bad cholesterol, and that's how it
Okay.
can affect. So it's very important for us to have a sort of a very controlled lifestyle, because everything is sort of linked like a domino. If one is not working properly, it affects all the other systems.
Okay. And what kind of exercise would you suggest for somebody to do, and how often, how long should they be
Okay,
exercising?
that's a good point. I think we talked about the diet, we talked about the risk factors, we talked about how
Yeah.
we diagnose. Exercise should be an integral part of our life, and there are simplest ways to increase our activities. The target is, the American Heart Association says, if you can walk for 30 to 40 minutes, that's from morning till night. You know, at work or going up the steps, all put together. If you cover like 10,000 steps, you have achieved your exercise, even though it's not like running on a treadmill or on a bike or riding a bicycle. And all of these things add up. So I would say start with your car parked at the end of the parking lot. So at least you
Mm,
get 1,000
minimal
steps,
things,
2,000
everything
steps
adds up.
just back and forth. And you do the same thing at lunchtime. If you got 30 minutes or 1 hour lunch, take a walk or walk to the restaurant and eat light meals. I would say try to aim for like 10,000 steps a day throughout the day. And if you can climb stairs and all these things, and you maintain this, and if you just walk for 45 minutes per day without changing anything else in your life, you would lose 20 pounds in 1 year. To that, if you
Wow.
add reduction in carbohydrates to a small degree, it can make a huge difference. So I think the exercise should be an integral part, and it should be made part of our daily life. It's not like, oh, I have to go to the gym, I have to change into dress, all these things. No, you can do it. You just walk around in your house. You can get 500,000 steps easily. Or if the weather is bad, go to the stores, Walmart, HEB, or Kroger, any store you like, just walk around for 30, 40 minutes. And that's how you can get your exercise. There is no reason for excuses when it comes to getting your 10,000 steps.
Wonderful. That's really significant.
Yeah.
Okay, can you comment on the SAD diet and how acculturation has increased the amount of obesity, hypertension, diabetes
Well, if
in
you look
the
at all this food that is served in the parties, 10 course, 12 course food, it is all filled with oil, butter,
loaded with carbs,
saturated fat,
fat?
cholesterol. I mean, everything that you eat is basically, everything that you're putting in your mouth is something that is harmful to you in terms of your heart disease, diabetes, hypertension, and kidney problem. And how do you expect to be healthy? It is not. I mean, that's something we have to understand, because it tastes good, it looks good, and you feel
It's
good,
not
but
healthy for you.
over 10 years, 20 years down the line, you're going to have to pay the price.
I agree. So if you have to summarize, what are the next steps that somebody can take starting
As I said,
tomorrow or set goals for the new year?
yes.
What would you suggest?
I would say, between the ages of 30 and 45, get a complete checkup. If you need, get a complete cardiovascular checkup, including the calcium score, which you said, which is the simplest test can be done. Check your cholesterol level, your blood sugar level, and your kidney function level. And after that, your doctor can give you an advice as to what kind of diet you need to be on, and exercise, which you already mentioned. And when you do these things, when you keep your weight under control, that is the first and the most important fundamental thing to reduce the risk of heart disease. Because obesity is a reflection of our lifestyle. And if we can keep our weight down, I think it will help us to be on the right track and hopefully, prevent having major cardiovascular events at young age or even having sudden death.
Thank you so much, Dr. Nikam. So
Thank
that
you,
was a
Dr.
wonderful
Manju, and
thought process on
yeah,
trying to prevent heart disease and identifying. Thank you very much.
you're welcome. Ladies and gentlemen, you have been watching a Triple N Media. I am Dr. NIK NIKAM. I didn't know I was going to be interviewed. This is the
Thank
first
you.
time anyway. I'm glad, we have shared some very important tips for you as to how you can take care of yourself. 80% of the work has to be done by the patient. The doctor can only give you certain directions and advices, but the real labor is with the patient, and that is with you. Hopefully you have some important message that you can utilize and stay away from the heart doctors. I mean, that's my final advice.
I think there's a saying, we should own our health.
That's absolutely right. Thank you so much for watching this,
Yeah.
and please do subscribe to our YouTube channel, and we will see you in the next presentation.